Now we will discuss the therapeutic uses of naloxone. Naloxone is primarily used for therapeutic effects in the management of an opioid overdose and opioid-induced respiratory depression. Its main purpose is to rapidly reverse the effects of an opioid and restore normal respiration. The primary therapeutic uses of naloxone includes opioid overdose reversal. The main function of naloxone is to reverse opioid overdose, and naloxone is often administered by emergency medical personnel, first responders, or even bystanders in emergency situations. It can quickly counteract the life-threatening respiratory depression caused by opioid overdose and potentially save lives of a drug addict. The second one includes reversal of an opioid side effect. Naloxone is used to reverse side effects of an opioid. In some cases, naloxone can be administered alongside opioids to mitigate these effects while still providing pain relief. The third one includes neonatal opioid withdrawal. Naloxone may be utilized in neonatal intensive care units to manage newborn infant infants experiences withdrawal symptoms from parental opioid exposure. Naloxone helps alleviate withdrawal symptoms in neonates by blocking the effects of opioids. This means that if a baby is born and his mother is an opioid addict or drug overdose, so its effect can be seen in his newborn child. So naloxone is given to that newborn child to quickly seduce the effects of a opioid.
Machar is biting my leg.
Now we will discuss the pharmacokinetics of naloxone. Naloxone is primarily administered intravenously or intranasally, as I mentioned in previous slide, and its pharmacokinetics vary depending upon the route of administration. Here are some key points regarding the pharmacokinetics of naloxone. We will discuss intravenous and intranasal separately. Absorption. Intravenous administration results in immediate and complete bioavailability since the drug directly enters the bloodstream. The blood travels whole body in very few time. So while injecting the naloxone through veins, the naloxone quickly reaches every part of the body and reverses the drug opioid overdose. The second one, intranasal administration, allows naloxone to be absorbed through the nasal mucosa. The onset of action is slower compared to intravenous administration, but it still provides relatively rapid effect. When we give naloxone through nasal cavity, it reaches it reaches brain more quickly than the body. So it tries its best to overcome the opioid overdose. The second one is distribution. Naloxone has a moderate volume of distribution, indicating that it distributes throughout the body tissues. The drug readily crosses the blood-brain barrier, allowing it to reach opioid receptor in the central nervous systems. The third one is metabolism. Naloxone undergoes extensive first-pass metabolism in the liver. The primary metabolic pathway is glucuronidation, while naloxone is conjugated with glucuronic and to form naloxone 3-glucuronide, which is inactive. The fourth one is elimination. When naloxone has performed its function, it is important to eliminate the excess of naloxone through the body. The elimination half-life of naloxone is relatively short and ranges from 30 to 120 minutes. and the drug metabolites are primarily excreted through urine formation. Now we will discuss the precautions needed while giving naloxone. Naloxone works to reverse opioid overdose and stays in the body for only 30 to 90 and in some cases 120 minutes. But many opioids remain in the body longer than that. Because of this, it is possible for a person to still experience the effect of an overdose even after taking the dose of naloxone. Some opioids are stronger and might require multiple doses of naloxone. People who are given naloxone should be observed constantly until emergency care arrives. They should be monitored for at least 2 hours after the last dose of naloxone. Meeting end हो गई है? Now we will discuss the side effect of naloxone dosage. Injection site reactions include uh, localized pain, redness, or swelling at the injection site when the naloxone is administered through intravenous mode of administration. The second side effect of naloxone dosage include agitation or restlessness. Naloxone can sometimes cause agitation, irritability, or restlessness, particularly in individuals who have abruptly entered opioid withdrawal. The third side effect of naloxone overdose include increased heart rate and blood pressure as it is a part of mechanism of its action. The side effects of naloxone varies from person to person depending upon how much opioid was present in his body and how much naloxone was needed to overcome the opioid overdose. Now continuing over the side effects of naloxone dosage. The other side effects include acute opioid withdrawal. Naloxone can precipitate acute withdrawal symptoms in individuals who are physically dependent on opioids. These symptoms may include nausea, vomiting, increased heart rate, elevated blood pressure, sweating, tremors, muscle aches, restlessness, anxiety, and agitation. However, the withdrawal symptoms are generally short-lived and not life-threatening. Moving to the other, reversal of pain relief. Naloxone can reverse the analgesic effects of opioid, leading to a sudden return of pain. This can be a concern if naloxone is administered to individuals who are using opioid for legitimate pain management purposes. However, in case of overdose, the potential benefits of saving a person's life far outweigh the temporary loss of pain relief. Recurrence of overdose. Naloxone's effects are relatively short-lived compared to many opioids, and it may be wear off before the opioids are fully metabolized. This means there is a risk of overdose recurrence if the person has taken a high dose of long-acting opioids. Therefore, it is important to closely monitor individuals who have been administered naloxone and seek further medical attention as necessary. Potential for agitation. Naloxone may cause agitation or irritability as it reverses the effects of opioid. This can be concerning in some situations, particularly if the individual becomes combative or aggressive. Proper precaution and trained personnel should be available to handle any potential agitation. This is usually overcome by keeping a personal psychologist which is available to the patient 24/7, so he guide him to how to overcome the opioid overdose and the side effects of naloxone. The other side effect of naloxone include interaction with other medicines. Naloxone is generally safe to use and has low risk of drug interactions. However, caution should be exercised when administering naloxone to individuals who are taking long-acting opioids, such as methadone or buprenorphine, as the duration of naloxone's action may be shorter than the effects of these medications. Monitoring is necessary in such cases to avoid severe side effects of naloxone dosage. Hmm. The next subtopic of my presentation is public health implications. Public health implication of naloxone access and distribution programs as well as the associated prescribing guidelines and legal barriers are significant in addressing the opioid crisis. Here is the discussion of these aspects. Naloxone access program. In previous years, naloxone was not easily accessible to its patients, and a complete prescription of a registered medical doctor was required to give naloxone to a person. But now, naloxone access program aim to make naloxone readily available to individuals at risk of opioid overdose as well as their family members, friends, and community organizations. These programs help increase the availability and distribution of naloxone, ensuring that it is accessible when needed. They may include strategies such as standing orders, third-party prescribing, community-based distribution, and pharmacy-based programs. It is important to spread awareness in public about the naloxone dosage. First of all, everyone should know overdose education. Along with naloxone distribution, the program of naloxone overdosage education often provide education on overdose recognition, response, and administration of naloxone. Training individuals to recognize the sign of an overdose, calling emergency services, administer naloxone, and perform rescue breathing can save lives. Education also helps to reduce stigma associated with opioid usage and encourages community engagement in harm reduction efforts. Uh, Everyone should know how to overcome overdose of drug addiction so that it helps its relative and close ones to overcome the shortcomings of that overdose. Other awareness include prescribing guidelines. Prescribing guidelines for naloxone are crucial to ensure appropriate use and distribution. These guidelines provide recommendations to healthcare professionals on who should receive naloxone prescription, including patients at high risk of overdose. Individuals use high dose or long action opioids and those with a history of substance use disorder. Guideline may also address co-prescribing naloxone with opioid to enhance safety. Legal barriers. Everyone should respect the legal barriers set by their country and government. Legal barriers to naloxone access and distribution have been a concern in many jurisdictions. Some of these barriers include restriction of naloxone prescribing, pharmacy dispensing, and accessibility. Such restrictions can limit the availability of naloxone and hinder its timely administration during overdose situations. Overcoming these legal barriers often require advocacy efforts, policy changes, and public awareness campaigns to promote the importance of naloxone in saving lives. If naloxone is available to every person, then it may be misused. So it can cause more harm than benefit. So it is important that everyone should respect the legal barriers so that it is not misused and the harm is reduced. The other in the moving to the next point is harm reduction and prevention. Naloxone access programs are a crucial component of harm reduction strategies. They aim to reduce the harm associated with opioid use by preventing overdose deaths. These programs do not encourage or enable drug use but acknowledge the reality of opioid dependence and the need to address the immediate life-threatening risk. Naloxone distribution also provides an opportunity for outreach and engagement. facilitating connections to addiction treatment and support services. It is important that there must be a rehabilitation center in every 10-kilometer range so that the drug addicts can spend their time in doctor's supervision and their addiction habit is controlled. Future of naloxone. The field of naloxone formulation and delivery method continues to evolve with ongoing research and development focused on improving efficacy, ease of use, and accessibility. Here are some future direction and emerging research areas. Long action formulations. Major pharmaceutical companies are working to make naloxone that can immediately reverse the opioid effect. There is a growing interest in developing long-acting formulation of naloxone to extend in duration of action and reduce the need for repeated doses. Reformulation could provide sustained protection against opioid overdose, potentially reducing the risk of recurrent overdoses after naloxone wears off. Various approaches, including depot injection and implantable devices, are being explored to achieve extended release naloxone. Many scientists have completed this approach, but still researches are being done to make effective vari- variant of naloxone. The delivery method of naloxone are also improving day by day. First of all, international delivery enhancements. International naloxone has gained popularity due to its ease of use and effectiveness, as it requires no medical practice to give naloxone intranasally. So it is considered as easy method to deliver naloxone to patients. Research is focused on enhancing the intranasal delivery system, such as improving bioavailability and absorption. Efforts are underway to develop nasal spray that offer higher naloxone concentration, rapid absorption, and improved distribution within the nasal cavity to enhance effectiveness and reduce the risk of overdose recurrence. Researchers are working daily to make naloxone as easy as the usage of an asthma spray, so patient may not feel depressant when the naloxone is not available to him. So that's why researches are being done to make the delivery method of naloxone easy for everyone. The other alternative delivery methods that are being discovered day by day include novel approaches such as transdermal patches, buccal films, inhalable formulations, and intramuscular devices. These alternative delivery methods aim to provide different options for naloxone administration, expanding its accessibility and ease of use in various settings. The other point is user-friendly devices. Researchers are working on developing user-friendly naloxone delivery devices that can be easily used by non-medical personnel and bystanders. These devices may include auto-injectors or pre-filled syringes with simplified administration processes. The focus is on creating intuitive devices that require minimal training and can be readily deployed in emergency situations. Combination formulation. Another area of research involves combining naloxone with other medicines such as opioid agonists or partial agonists like buprenorphine. These combination formulations aim to provide both immediate overdose reversal and long-term opioid receptor blockade to prevent subsequent overdose. The goal is to develop formulations that offer a dual therapeutic effect and addressing both acute overdose situation and opioid use disorder management. It means that researchers are in struggle to make naloxone compatible with other formulation medicine so that it do not react with other medicine and cause side effect or harm to the consumer. Here are the references you can visit and learn more about the naloxone overdose reversal. program. Thank you for listening to my presentation. Hope you enjoyed. Allah Hafiz.
Allah Hafiz.